this McNemar test. Now this McNemar test, again, like all other sessions, we learned the first basic concepts, then the research questions, the underlying assumptions and hypothesis, what are the commands and how do we interpret, and then summarize the commands. So this McNemar test is again a type of non-parametric test. Like all the tests which we have done together, chi-square, various types of chi-square, it is a non-parametric test. What is a non-parametric test? When the data is not normally distributed. That's why in this case, we have not tested the assumption of normality. Whereas for the correlation, we tested the assumption of normality. And when we will learn on Saturday regarding the testing the difference between the two mean or median, there also we will learn regarding this normality. So whenever the data is normally distributed, we do a set of parametric tests to test the association or to test the difference between the two means or more than two means. Whenever the data is not normally distributed, then we apply the non-parametric test. There are certain tests, that's why where we don't need to check the normality of data, because by default they are non-parametric tests. So chi-square, the various types of chi-square and McNemar test is a type of test which is a non-parametric test, and it is a type of test which is for the paired nominal data. Paired nominal data, what do we mean by paired observation? We will see what is that. That means the same set of individual we have measured twice. That's why we call it as a paired data. We will see the example how we can have the paired data. And this is also known as the McNemar chi-square test, because the test statistics which it yields, it has got a chi-square distribution. That's why its another name is the McNemar chi-square test. So there are certain type of study design where this test can be applied. So like first and a very common is the pre-post study. Like you are doing some workshop. In this case, like I'm doing a workshop. Maybe I have done something before the workshop, carried out a skill assessment. Maybe I have calculated the marks of all of you and then decided pass and fail. And then after attending the workshop, again, I give to you that questions, maybe the MCQ based same questions. And you have, again, I decide for the two categorical variable, people who have secured more than 50% the pass and who have secured less than 50% has failed. So in both these cases, you have got a pre-post study. So you are using a single tool for measurement, and that is a pre-test and the post-test. In that case, you can apply this McNemar test. So it is a pre-post study. You measure the changes over time with intervention. The second type could be a pre-post study, and where we determine there are changes over time without intervention, like season, and maybe you can decide whether prevalence of non-hypertensive whether and hypertensive in single set of individual, and then again you measure the same individual. So it will be a paired data, the same set of study subjects, pre and post, but without any intervention. Then also this can be done. And the third can be if there are some different between the conditions, like crossover. And we will see what are these type of study design. So in this case, if I want to measure a categorical variable X on the same individual, like I have categorized it systolic blood pressure as high and normal. So this I was giving this example that maybe I took 50 MBBS students and I have measured their blood pressure in summer, and then again I have measured their blood pressure in winter. And I have made this categorical, from this continuous data, I have made a categorical variable. So I have categorized as proportion of students who were having high BP in summer and proportion of students who were having high BP in winter. And if I have to test these two proportions, I'll use the McNemar test of two proportions. So at two different time points. There can be one situation where the same set of individual, maybe the same MBBS student, I have measured the systolic blood pressure before the workout and after the workout. So under the two different conditions, I have measured the blood pressure. Again, the two different sites, maybe for the same individual, I may measure the blood pressure in the right arm and in the left arm. So this is, I am doing it at the two different sites. This is again a paired value, or under two different instruments, like maybe I may measure the blood pressure with an automatic blood pressure machine and a manual blood pressure machine. But in all these cases, I will classify or categorize this systolic blood pressure into high and normal. That means I have to make a categorical variable. Otherwise, for such type of continuous data, I need to use the paired t-test, because paired t-test we apply for the continuous variable. But in this case, we are making a category, and the proportion testing of two proportion across two different time point, we apply the McNemar test. Again, in this case, we can measure a categorical variable like depression status. So you can measure the presence or absence of depression at two different time points without any intervention. You can measure the depression with one drug and then with more than one drug, or you can measure the depression before the counseling or after the counseling. In this case also, all these three cases, they are paired values. That means paired observation. So what can be the research question? So if you want to know whether any change in the proportional scores in the paired observation, and if you want to measure the change in these proportion, then you will use this McNemar test. So the research question is whether there is any difference in the proportion of BMI status. Again, in this case, you cannot have more than two categories. So these categories, this should be only two categories, both the intervention and both the variables. So before and after 6 weeks program, again, what is the status of the BMI, comparison of proportion of pain status. Again, the pain status has been categorized as moderate versus severe. And there are two times I have measured, before surgery and after surgery. So it is a 2x2 table. Similarly, any difference in proportion of passing across pre-university and university examination of the MBBS students. So again, this is there will be a pass and fail, and there will be two exams like pre-university and university. So this will also be a 2x2 table. So remember, McNemar test we can apply only in 2x2 table. We cannot apply McNemar test in 2x3 or 3x3 table. So what have you observed? That there is a dichotomous categorical variable in each research question, and we want to compare it before and after. And the such study design are called as the pre-post study. And McNemar test of two proportion we use. So there are some underlying assumptions. The first assumption is that the one dependent variable, whatever we are measuring, that is on a dichotomous categorical scale, and that we have seen, it should have two categories. Similarly, the one independent variable, it should also be having the two categories or related groups or match pair. And the participants are from the random sample from the population. So the null hypothesis in this case is that the population proportion difference between the paired value is equal to 0, whereas the alternate hypothesis states that the population proportion difference between the paired value is not equal to 0.